Just to get a little engagement, if you would just put your name, the agency you work for, and one event or one holiday experience that you're looking forward to in November and December, that would be great. So let's talk about today's session. We're really going to focus on one of the most critical skills in case management, how to connect assessments, care plans, and transitions of care using the golden thread theory. We'll explore how to move forward from identifying needs to documenting goals, selecting interventions, and ensuring smooth transitions, all within Medi-Cal and ECM expectations. Thank you. I'm starting to see everyone's kind of responses. Thank you for sharing. All right, next slide. Oh, yes, thank you. By the end of this session, we're hoping that you will be able to define what makes an assessment comprehensive and trauma-informed, turn what you learn in the assessment into SMART goals, align assessments, care plans, and interventions so that your documentation tells clear and connected stories, understand the difference between comprehensive transitional care and transition of care, and then strengthening documentation and quality in line with the ECM standards. Think of today as both a skills refresher for some of you and a quality improvement session for everyday workflows. Next slide, please. All right. So let's pause. Thank you, everyone. I'm enjoying seeing the interaction in the chat box. And look at the big picture. All right. We don't just want to meet clients once and walk through all the distinct phases of their care and who they are. This is something we do. Yes, I'm also excited about turkey, one of my favorites. The intake and the assessment is where we listen and we learn and we identify needs, strengths, and what matters most to the client. And in saying that, I want to emphasize that it's what matters most to the client and not to ourselves. Care planning and goal setting is where we translate those needs into clear, measurable goals. And this is where the golden thread starts. Okay. This for ongoing support and coordination, this is our day-to-day case management work. So the follow-up that happens here, coordination that happens here, advocating for our clients and their families, and adjusting plans as things change and progress. The comprehension transitional care are these short-term event-driven moments when clients experience a major change. For example, maybe go to the hospital or going to be discharged from the hospital. Maybe a placement change happens here. So there's a need for a little bit more coordination to happen during the comprehensive transitional care. And then lastly, here we have the transition of care or discharge. This is something that's usually planned, right? So you have time to prepare. This is when ethical closure process in celebrating the progress for that transition to happen. And it's really a way to stay connected with the entire process, as well as connecting them with maybe, the case manager or whatever the warm handoff will look like for this patient. And then really key is that you're documenting at every single phase. Obviously, each note needs to show the continuity in care, how you move from one need to plan to action, and then finally outcome. That's what makes our work visible and what demonstrates the value of case management, as well as when you're working with collaborators, there's also the need for them to maybe evaluate what's in your documentation and have a clear understanding of what is it that you're doing or the work that's happening with this family. Next slide, please. All right.
All right. Hello, everyone. So I'm going to go over what makes the assessment basically comprehensive. So when we talk about comprehensive assessments in case management in particular, we're going to be talking about seeing the whole person. In previous trainings, we have kind of alluded to this of the whole person approach. This is not just the immediate presenting issues that we're assessing for here. This it's easy to focus more narrowly on diagnosing or if there's someone in crisis, but the comprehensive assessment is really meant to help us understand the context, the contributors, and any barriers that a client is having. So let's walk through what that would include. So the clinical needs, these are the medical foundation. Here are the diagnosis, the symptoms, the chronic conditions. These are typically diagnosed by licensed professionals, medical providers, and so forth. But as part of your comprehensive assessment, you are gathering this information. This helps us understand health risks and what needs to be monitored and any kind of coordination that is needed. Next, we're also assessing behavioral health and substance needs. Many of our clients have behavioral health or substance use concerns that are directly affecting their engagement, their functioning level, and their stability overall. These are important for safety planning, for referrals, and care coordination. The next component that we're assessing with the comprehensive assessments are the social drivers of health. Housing, food access, financial stability, transportation, any safety directly impacting their health is something that you're assessing during this time. If these aren't addressed, it's very hard for clients to make any progress in any other areas. So it's really crucial that the social drivers of health are really identified during the comprehensive assessment. And then another crucial part that as case managers, we really do get involved in is the systems, identifying the systems that are supporting the clients. Many clients are navigating multiple systems, schools, probation, CPS, aging services, disability services. So knowing who's involved helps us coordinate, avoid duplication, and build a more aligned plan. Next, the strengths and protective factors. I will say in comprehensive assessments, sometimes this often gets overlooked. Strengths tell us what the clients can build on. So really assessing what their strengths are is crucial. Protective factors tell us where the resiliencies is and what already exists. Do they have family? Do they have faith-based organizations that are supporting any skills, anything that will motivate them? And the routines, what routines do they have? Can you build on those to really help address any of the barriers that they're facing using those strengths and those protective factors? Client readiness, preferences, and their priorities. At the end of the day, this is their plan, this is their goals that they're trying to accomplish. Sometimes we'll come in and we'll identify 10 needs, and then we must first identify, which is the first that the clients want. What are they ready for? What matters more to them? A client-driven care plan is what makes goals achievable and meaningful, specifically to engage them and then make them part of that plan with them. And most important reminder here is document the why, not just the what. Comprehensive assessments can really turn into a tedious document that sometimes we don't want to write or we don't want to go through, but if you really see this as the plan that really kind of supports what you're going to be achieving with your clients, answering the why is going to be crucial when you're developing these plans with them. So anyone can really list the problems. We can usually, even for ourselves, go down a list of all the problems and barriers that we're having. But what makes the assessment useful is what creates the golden thread that we've been talking about in previous sessions, is showing the why it matters and why it's important for them in particular when you're creating any kind of plan with them. For example, not just the client needs housing. No, we're asking the why. Why the lack of housing is impacting their safety. They're affecting their access to care and their health outcomes. This is what leads to clear goals and strong, defensible documentation. So the documentation will really support this. And now I'm going to hand it off to Darlene to share for us the 4 philosophies that guide effective case management. Next slide.
All right. So can you hear me? Oh, yeah. Okay. So when we are completing these assessments, the how we gather the information is just as important as what we're gathering. So you see the slide talks about being trauma informed, and being culturally responsive. And I think it's very important for us to make sure that we're asking questions, not just to check off that box or reading as it is, but really understanding our community and asking questions that are, again, not going to re-traumatize our community. Someone who maybe has had some violence or a recent loss, and asking the same question over and over again is not going to be beneficial to them. And again, we don't want to re-traumatize. So I think that this is important to understand, and do our research prior to our visits to ensure that, again, if this question was already asked and it's something on our checklist, that we can already document that and then move forward with the rest of the assessment. And again, I think it's also valuable to note and let the patient know or the client know that this is a choice. If at any point they would like to skip a question, that it's okay for them to say, I'm not ready to answer that question at this time, and then move on without making it too difficult for them. All right. And then to avoid medical jargon, I think that we also have to make sure that, we're very aware of the medical jargon, the clinical terms, the legal phrases that we have and we've read, and we have to make sure that we follow. However, when we're working with our patients or our clients, it's important for us to have them understand the wording in a way that is, again, age appropriate, or that's in a term that is something they can understand. Okay. Notice your pace, your tone, your body language. Are you squared off, or are you in an environment that makes the patient client feel safe? um, if if you notice that there's short answers, or quick responses, or they're looking down and shutting down, make sure that you're identifying where you're at in this process, and that maybe you take a minute to step back and rebuild rapport, and then ask the questions in a different manner. Do not document assumptions. So document expressed needs, and that's important. So in trauma-informed documentation, we need to avoid guessing or interpreting. For example, instead of client is unstable, you can write the observation or the stated need, right? So clients reports difficulty managing medication and missed 2 PCP appointments this month. This protects the client and you, when you're wanting to make sure that, if anyone else reads these documents, that they're safe, and that, again, it's expressing the need and not the assumption. All right, next slide, please. Thank you. All right. So this is just kind of like a visual to kind of support what we're talking about throughout the presentation. But this is really a way to also summarize the core principles of trauma-informed care. And this really comes from SAMHSA and the guide that they have provided. So the link's there for all of you to kind of reference later if you want some more information on it. But let's talk about the key principles here, okay? So safety. Everything starts with physical and emotional safety. So every client needs to feel safe in the environment that you're meeting them at, whether it be in the community, maybe it's in a clinic setting, or at a community-based organization's office. Again, making sure that the client or patient feel safe. And the questions that we ask and how we respond, and really that they feel and they know what's happening, or as we say, predictability of the situation. They know that when they're going to that visit, that this is going to feel like a safe place for them. Okay. So client enters into our care after a negative or traumatic experience with other systems, with interactions in the community, and just being transparent is very valuable. So as much as possible, life happens, work happens, we might have to change where the visit's going to occur, but explaining the process, explaining expectations and timelines is a way of really making an individual feel safe. For example, this information helps us match you with the right services. So that is why we're asking these questions. We're wanting to understand what your needs are and how we can match those questions. There's mutual collaboration that happens here as well. And instead of doing for a patient, we are working together. And I think that that's something that's so valuable to this process, is making sure that we're working together to ensure success. And we want to make sure that our patient or client feels that they're a partner in every step of this process. So everything from care planning to, what resources are out there and how we're going to refer them, and often checking in, validating their perspectives, and involving them in all areas of the decisions that are happening. This also is going to create buy-in and make sure that they're set up for success, and not that we're enabling them and doing for them. And then lastly, we have here empowerment and choice. So trauma often involves a loss of control, right? And so we can counteract that by giving clients choices whenever possible. And while that may feel like you're lengthening the time of a visit, it's going to be very crucial to really all of this, that safety, being, establishing trust, and then again with mutual collaboration, giving them the choices, making sure that they feel supported, and also that we're understanding what their support system looks like, and maybe if needed, asking them to also be a part of this process. Empowerment increases confidence and support self-management, right? And again, we're wanting to make this something that's sustainable and long-term and creating true change. And so that happens again with empowering them to support, to ask their questions. And then really across all principles, we must consider a client's cultural background, generational trauma, generational experiences, identity, history in the systems. For many of our clients, trauma is linked to discrimination, immigration experiences, family separation, racism, and also community violence. So making sure that we're honoring these experiences or holding a safe place for that is also very important. The goal of trauma-informed care is not just to avoid the harm, it's to create an experience where your clients really feel safe, right? Respected and empowered. So these principles are really going to be something that will guide you throughout the entire process. Next slide, please. All right. Let's talk strength-based approach. And really, it's an important framework. We use it. Some people say, well, obviously it needs to come from a strength-based approach, but I think historically there has been a lot of look at the problem and let's see how we can support the problem. Really coming from a strength-based approach is going to change the what's wrong to what's strong, or, what wonderful tools do we have to really support, your long-term goals. And so our clients have survived significant challenges: housing instability, trauma, poverty, again, some of these other systemic barriers that we were talking about, The fact that they are here seeking the support already just demonstrates resilience, and our job is really to help name that resilience for them and build on those strengths. So people are the experts of their own experiences, just like you're all the experts of the work that you're doing. And we're just here providing tools to support that work, right? So even when a client is feeling overwhelmed or seems overwhelmed or disorganized, they still know their lives best. And it's really us there to support that process. Next slide, please. Okay. Case management approach. Again, it's a really good visual. And this slide really what it does is tie the core principles that guide effective case management. No matter what population we are working with, children, youth and families, high utilizers, unhoused clients, these four approaches shape how we build relationships and support change. So let's start on the left side if we can. So client centered, I'm sorry, the right side. Client centered case management. What it really means is that we are that the client is the driver of this process, not us as the case manager. So it includes focusing on the client's needs, aspirations, and goals. Now, what we think they should focus on, again, is not what we're going to focus on. We're going to have them tell us what it is that they need. So for us, maybe, you know, that they're living in their cars is a problem, and we want to make sure that we address that first. But if that's not an identified concern for our client or our patient, it's important for us to make sure that we're honoring what is valuable to them. So taking that step back and making sure that our own biases are not involved in this process. Honoring and respecting their autonomy. So again, making sure that we're seeing things from their lens and not our own. And our role is to support and not direct the work that's being done. Emphasizing choice and control. So this is really important for this work because clients who have experienced systems that are limited or have limited their control of their decision making, like welfare or corrections, or someone who's dealt with some medical trauma, they are going to feel like they don't have control, and that's going to cause anxiety. So really making sure that we're emphasizing this is their choice, this is their control, and that we're a part of the engagement piece. So instead of you need to or you should, what do you feel you're ready to work on? Or you know what are your thoughts on this perspective? This way of approaching or wording things differently is going to again help build that trust, increase engagement, and really will support that more sustainable change that we're looking for when we're working with our community. And so, again, being client centered, make sure the client's voice is there first, that their preferences and their culture are also things that are addressed. And then when it's culturally informed, we're going to be able to support them in ways that meet them with their values, maybe family structures, and community contexts and their lived experiences. And then for trauma informed, this quadrant, clients often come with their histories, right? Individual, family, or generational kinds of traumas. And talking about it is okay. And again, not avoiding it, but making sure that when we're supporting it, it comes from a place of them sharing and us helping them build a sense of safety. And we're working at a pace that they feel comfortable with, so they're not shutting down or feeling overwhelmed. And again, strength-based, we look for what's working and not just what's broken. And oftentimes it's making sure that our goals are strength-based, that they're measurable, and that there's something that's realistic for creating change. And so a strong case management approach blends all four of these elements while being client-centered, culturally informed, trauma aware, and strength based, our assessments become more accurate and our case plans become more effective and our relationships with clients become more meaningful. So, again, this foundation is really high quality when we're working with our clients doing our case management services. Next slide, please.
All right, thank you, Darlene, for that. Um, so I want to go ahead and transition over to, there's going to be a lot of information, but I'm going to bear with me. I want to transition over to one of the core ECM services that sometimes gets missed as we're doing ECM, and that is the comprehensive transitional care. We're going to be going over the comprehensive transitional care briefly here. However, we're also going to be going over what transition of care is. So there is a difference between both. So I'm going to go ahead and just give you a quick overview of comprehensive transition of care. This is something that gets missed, like I mentioned, because it's not something that we do all the time. This is meant to be a short-term, event-driven, and high-touch, triggered by a major event in your client's life or in the systems. So let's break it down a little bit. Your comprehensive transition care is a proactive. We don't wait for the clients to fall through the cracks. We reach out earlier. So this is those situations where we get a notice either from the alliance, we get a notice from the patients or the clients' families, or someone somehow notifies us that they're in the hospital, or they've been hospitalized for a mental health crisis, or they've been hospitalized and now they've been discharged to a skilled nursing facility. At that point, it is you as the lead case manager to take the responsibility of being very proactive and reaching out. You're coordinating. This is where we communicate directly with the hospitals, the jails, the foster placements, skilled nursing, the shelters, any other programs that is providing some sort of short-term supports for them. And then the comprehensive transition of care, this is usually where you pivot away from your care plan goals that you've created to be more of that long-term one. These are typically a transition that will last about 30 days. This is where you create specific goals that are addressing that short-term high-touch event that really needs that pivot. This is meant to stabilize them, and it's meant to prevent any rehospitalizations, any other emergencies that might come about if they're not addressed prior to that. So what triggers a transition of care? I mentioned it briefly. These are moments when your clients are most vulnerable and most likely to experience a gap in care. These are your hospital discharges. These are releases from jail or from incarceration, entering or exiting foster care. Sometimes these are situations where we miss it. Or this is also skilled nursing facilities, that coordination with the short-term skilled nursing facility, either from inpatient to outpatient or vice versa. Major changes in health status, housing, or any program eligibility. These transitions can become extremely overwhelming. Clients may not understand any of the follow-up instructions. Discharge paperwork sometimes can be complicated for them. They can lose their medications during these periods, or they can be unsure about what the next steps are. So this is where you as a lead case managers will be coming in to support during comprehensive transition care. So what does it include? Well, a couple things here. Case managers usually will provide a high value service during this period. We're doing the warm handoffs across different settings. We ensure communication between the discharge setting and the provider that's taking them. So hospitals, for example, you're coordinating the follow-up visit with their primary care provider. You're providing any relevant information. The other thing that sometimes gets missed here is the discharge planning with the families. A lot of times including that natural support system and what that discharge looks like gets missed. They're not involved. And keep in mind, these are the individuals that will be supporting that your client if they have families, friends, or anyone that will be supporting when they're discharged, or any other community programs for that are needed during this transition period. Medication and appointment reconciliation. We are confirming that they have their medication. Any changes that are being medications that need to be filled, prescribed, or anything, making sure that providers are talking to each other, making sure that they understand what's been explained to them upon those discharges. And any upcoming appointments, do they have reminders? Do they know? Do they need transportation to get to that follow-up appointment? Navigating to follow-up care again for the resources. Do they need to apply for a new benefit? Do they need housing? Is there any food, meal preparations, or anything that needs to be provided? Any supports that stabilize during that transition period are crucial. The crisis and stabilization plan. So this is part that goes into that transition. We identify immediate risk, we create safety plans, and we prevent the ER visit, relapses, or any reincarceration. Monitoring for up to 30 days. We check in frequently. So this is where you might have been checking in with them maybe bi-weekly. Here, we really want to check in on them on a weekly basis, maybe twice a week. The frequency is really to stay connected and making sure that nothing falls between the cracks. So this is one of those short-term basis, and your goals will pivot to ensure that they're meeting that. So again, this is really to prevent any relapse, any lapses in care. We're going to reduce avoidable hospitalizations or any hospital use. We're going to keep the client connected to the right services at the right time. And this is the most impactful parts of our case management because it directly impacts any kind of crisis that might come about from not getting the proper discharges. Can go to the next slide. All right. So now that we've received a little bit more information on what our comprehensive assessment domains are, as well as the transition of care, I'm gonna start talking a little bit more into how do we turn these into goals. For example, improved health isn't necessarily a measurable goal. That's just a statement. Reduce ER visits from 3 to 0 in 90 days. Well, that's something that you can measure and you can really support with data. So every goal should have a problem or a need, a measurable outcome, a timeline, responsible party, and ensure that you have your client's voice in it, that these goals that are being created are client-centered and are goals that are measurable and something that they can reach when they start working with that. So your documentation is what success looks like, and how we'll know when we're there. So again, you're tracking this information. So next slide. All right, so how do you create SMART goals, which is are clear, measurable, and tied directly back to your client's assessment needs? SMART goals are what help us show progress, demonstrate medical necessity, and guide our interventions. Without a SMART goal, it becomes very hard to document the impact and justify why we're continuing to provide services for ECM. So I want to break that down a little bit more for those of you that might not have seen what SMART goals, but I think this is, for the most part, the way that most documentation for medical necessity is required. But SMART goals framework is specific. A specific goal clearly identifies the what, who, when, and why. It avoids general statements like I mentioned improve health or getting stable. A strong example would be a client will schedule and attend a primary care appointment with case management support. This specifically tells us exactly what action and support is expected. Measurable goals let us track progress using observable changes. So this is where the data is going to really help us. Number of ER visits, number of appointments completed, forms completed, follow-up tasks that we're supporting with, So an example would be reduce ER visits from 3 to 90 days. I mean, reduce ER visits from 3 in 90 days to 0 in the next 90 days. So again, we're trying to track a reduction in preventable visits for the ER. So a measurable goal lets us look back and say, did the progress happen? Achievable means realistic for the client's readiness, strengths, and available resources. So we don't want to set goals that the clients are not ready or able to work on. So this is crucial when we're developing these goals. Kind of going back to the 3 different philosophies and core values in case management that Darlene spoke about. These are their goals. So when we're creating these goals and working them out with them, it's like if the who is the client will be submitting an application within 2 weeks, we got to make sure we're adding with case management support if the ultimate goal is that you will be supporting for that task to happen. This is attainable because the steps are clear and the case management involvement is in there. Their relevance. This means that the goal is tied directly to the assessment needs. If the need isn't in the assessment, the goal shouldn't be in the care plan. So this is crucial. When we're doing comprehensive assessment, we are gathering a lot of information and then trying to figure out what we're prioritizing, what is going to be the goals that we're establishing. This really kind of helps. The relevance part of creating that goal is what's going to really support that. So for example, if the client reports any kind of food insecurities during the comprehensive assessment, then we should be looking at goals that are relevant for that client to be accessing food or any other services. And then the time bound. This is crucial. We always want a time frame for review and completion. This helps us stay accountable and gives us structure to follow. So by the next care plan review, I don't know, within 30 days or however it is, whatever timeline you want to give. I know some of you might follow, or your organizations might follow the authorization period. So by the end of 6 months, by the end of 3 months, the client will achieve this with the care plan. So it really is meant to really support the guidelines around the timeframes. I will say even short timeframes really help maintain a good momentum. A lot of times when you put goals that have an extended amount of time, it can become pretty difficult and overwhelming for some of your clients, especially as you're working with them and you continue referencing or kind of going back to that, like, this is what we're trying to accomplish as reminders for them. You want to make sure that they are goals that it is within a time frame that is reasonable for them with their capabilities, with their abilities to really support as you're documenting these. Otherwise, there might need to be a plan for shifting. So with all this information regarding the specific, measurable, achievable, and relevant time-bound goals, a quick example could be a client would increase food stability by completing a CalFresh application and enrolling in at least one local food resource. So for example, a food pantry or weekly meal delivery service within the next 30 days with case manager support for application assistance and linkage. So that would be a SMART goal that could be put into your plans for someone that is having food insecurities. I think the last thing here that I do want to point out in the previous slide was, one of the tips that I think is really important when we're documenting our SMART goals and creating those goals is that for ECM, we're also being audited, and we got to make sure that these goals are meeting our ECM audit criteria and requirements. Every single goal must be linked back to your assessment. If it does not tie to a documented need that you are documenting in your assessment, it probably should not belong in your care plan. This is how we demonstrate the medical necessity, the client-centered planning, and the alignment with all the ECM requirements. Okay, next slide. Okay, so I do want to get through some more slides, so this, I'm just going to really quickly reference this real quick. These are SMART goals across common needs. We will be sharing the slides so you can reference these back, but I do want to just kind of point out on here, I just go over briefly the food insecurity part. These are goals focused on helping clients access stable nutrition and benefits, again, strength-based. We want to make sure that we are supporting, for example, the CalFresh enrollment with a specific timeline, connecting to 2 free resources within the next 10 days, reporting consistent access to meals for 14 consecutive days. Each of these goals are very specific, measurable, and directly tied back to an assessment need that was identified during your comprehensive assessment. Can go ahead and move on to the next slide.
All right.
Is this one? Okay, go ahead, Darlene.
No, I think this is you. Yeah.
Okay.
No.
All right, so now let's talk about the importance of matching the interventions to the goals. So we're gonna briefly go over, we went over your SMART goals, and now within ECM, the other crucial part when you're creating those goals is that your interventions are where our skills, our coordination, and advocacy really shows up. So interventions tell us the how. We're helping them, how are we helping them get there? So interventions need to show effort, show coordination, show problem solving, direct linkage to assess the needs and your care plan's goals. So if the intervention cannot be tied back to your goals, then that weakens the golden thread. And we just got to make sure that we are supporting our clients with the interventions. So I'm gonna go ahead. Go ahead and just go to the next slide. I just want to make sure we get through the slides. All right. I do want to also kind of go in here when we're talking about interventions, and matching them to our goals. I want to clarify the difference between a skill-based case management activity and a not a skill-based administrative task. We see this often sometimes happen as we get working with our clients and making sure our documentation really shows the great work and the skills that we hold as case managers. So when we're documenting interventions, we want to show the value of the work that we're doing, meaning the actions that require the judgment calls, the coordination, the advocacy, the coaching that we do for our clients. So let's walk through some of the key categories of skill-based case management. So care coordination and advocacy. This includes contacting providers, advocating for appointments, troubleshooting barriers, and aligning systems on the client's behalf. Scheduling and support handoffs. Not just scheduling an appointment, but we're ensuring the client understands the plan, has transportation to that appointment, and the warm handoff communication is happening. System navigation. Helping the client understand how to access services. Who do you call? What are the next steps? Benefits and applications, assisting them with their SSI applications, CalFresh, general assistance, housing applications, any other benefits that really support them accessing and the needs that they have. Coaching, education, motivational interviewing. This includes helping clients problem solve, prepare them for appointments, supporting engagement through motivational interviewing techniques. These interventions that you can tell really show the effort and demonstrate the value that case management brings in when you're working with your clients. Now, let's talk about the not so skilled based activities. These are important, but these are administrative actions. These can be included in your notes because they are important to have for the completeness of your notes, but they should not be the primary intervention documented. So for example, your documented left a voicemail. Client did not answer the call, called patient or client and they didn't answer. Gave your client a phone number for them to call for scheduling an appointment for SSI or something like that. These don't really show the case management skills that you have and how you're supporting, especially when you're talking about closing the loop. If a note is filled with only these types of entries, honestly, it will not meet the ECM standards of documentation and does not show the progress either. Your notes should really always be tied back to your care plan and what goals you're trying to accomplish and what barriers and challenges you're trying to support your clients with. So the message here is strong interventions reflect action, coordination, and problem solving. They show your effort, your advocacy, your skills, and your movement towards the goal and supporting that client. And it straightens your clarity in your documentation and the impact that your services are having for them. Next, I'm gonna have Darlene help us out, go through a couple of more examples.
Thank you, Esmeralda. Yeah, so I just wanted to actually support what Esmeralda was talking about, a SMART goal, and really ensuring that our Z codes are appropriate to, again, the goal, and that they're matched properly. And again, this is something that we must do because of, mandates. And I think I want to do something different than the housing, I mean, food insecurity, since that was Esmeralda's example. But so let's do something, for example, like financial or income instability. The Z code that you could use is a Z59.6 or a Z59.7. Again, low income or insufficient social insurance. These are things that really will support the SMART goal. The client will become SSI, will need help completing their SSI application, and will also help them with their utility assistance within the next 30 days, with the support of the case manager and the community supports team, if that's where they connect with their systems. And then so the case management intervention, again, support with SSI submission, submit their PG&E care or LEHEAP, and then again, connect them to maybe some workforce programs. So what you see is the identified need as the financial instability, the Z code that is going to be utilized, what your SMART goal can look like, and then again, the intervention itself. And these slides are all available to you with, again, the examples of some of the SDOH kinds of identified ways of supporting the client. And again, based on what your own mandates are, these can kind of support that work. Stephen, you have a question?
Yeah, so you're referring to
Oh, we can't hear you, Stephen.
1 second. I'll type my question.
Great, thank you. And recognizing that we do have a lot of questions that are coming up, I will hopefully, while you're typing it, be able to answer the question, or if not, we can wait till the end. Next slide, please.
Okay. I have a feeling that, Stephen, you're probably asking about the Z codes and as this will pertain. So with ECM, and we will, at our next following trainings that we will have, we will go over a little bit about medical necessity, diagnosing with the Z codes, because those are ECM required SDOH diagnosing when it pertains, when you're attaching care plans and goals. Okay, so real briefly, what is a transition of care? At this point, I will want to point out that there's always a misunderstanding here of what a transition of care is. It's not usually something that is kind of discussed or usually you start planning this out when you start meeting with your client as you're talking about the services, and these services will end once you meet the goals. And that this is more of a structured way of ensuring that you're communicating a plan, an intention, and ethical wrap up of the process to ensure your clients don't fall between the cracks when your services are scheduled to terminate or you're going to be completing them. A transition of care isn't simply closing the case. So let me just walk you through a few of the key components. So transition of care, again, this is when you're terminating services. This is where you're ending the services with ECM. What does that look like? So it's a plan, it's a structured, and it's documented. We don't decide to transition a client suddenly or without the preparation. It is a process and it's not an event. It includes an active warm-off whenever possible. This means direct communication with the next provider, not just giving the client a phone number or a referral and then not making sure that you're closing the loop and making sure that warm handoff has been made to the next service provider if that's the plan. It begins at intake. So we should tell clients from the beginning of the ECM that this is time limited. This is part of also building that relationship with them. This is also part of kind of preparing them of what this service is also letting them know that there's a time limit to it. Our work together will continue until you fill in the blank, whatever the plan, whatever the coordination is going to be with them. This avoids your clients having any feeling of abandonments later, and they know what to expect. And this is also crucial when you start having, as part of your comprehensive assessment, you're already kind of setting up the stage that this is a time limit service, that you can reference that, you can kind of be preparing them throughout the process as you work with them for whatever the time period you're going to work with them. This is also a sign of empowerment and not abandonment, like I mentioned, for your clients. Sometimes our clients can feel abandoned. Sometimes they come with that trauma. And just ensuring that we're being mindful and we are being as transparent as possible with what that looks like is really important. Transition happens when your client is ready. So either they're graduating out of ECM services, they've met their goals. We're stepping them down to a lower intensity care. So the complex case management, our alliance team has a complex case management, which is a lot of more of the follow-up, once a month over the phone kind of frequency of contact and services, or some agencies have an internal coordinators or some sort of level. It's not as intense as ECM services, but you are coordinating that support for them and you're documenting that step down. It's also the transition to self-management and other service providers. So these are the clients that have been able to really meet their needs, have been able to learn how to, for example, schedule their own transportation to appointments, follow up with their visits. So this is crucial as you start assessing, is it appropriate to transition them out of the care for ECM services? So the process would include the final goals and the reviews, documenting what you've achieved, what remains, and how your client has progressed. Again, the warm handoffs. Ensure that you're doing a continuation of care. The team receiving the client and supporting from there knows exactly what their needs are, what their progress are, and any other information that you can provide to really support that continuation of care. And then client preparation and empowerment. We help our clients understand the next steps. This is a conversation where we make them feel confident in navigating the services that we've shown them how to navigate and know where to go for help. And then your discharge documentation. This is going to include your outcomes. It includes any remaining needs that are identified, referrals made, and your client understanding what the plan is. So transitional goals is to ensure the safety, the intent of closure of the services while maintaining a continuation of care and supporting your client's independence. The goal ultimately is for your client should be able to exit ECM services prepared, supported, and connected, and never feel like they're being dropped or confused about what the next steps are going to be.
Yes, you will be able to receive a copy of this Zoom. And for the sake, for the
Of time.
for the sake, yeah, for the sake of time, and honoring, Berenice's wanting to introduce some of the future sessions that we'll be supporting. I think that we'll go ahead and end here, if that's okay.
Mhm.
We do have all our talking points in the presentation. So if anyone needs follow-up or additional questions, you're more than able to, connect with HIP and we will make sure to get your questions answered. So thank you so much for your time today.
Thank you so much.
Okay, well, thank you, Darlene and Esmeralda. I am so sorry we ran out of time to get through all your content today. I know that there's a lot that we want to cover and share with folks on the line. And thank you everyone for kind of staying along with us through the duration of the call. And we really hope that you were able to learn something new and take something back to share with your teams. And before we have everyone log off, if you all are able to stay on for just a couple more seconds to help us complete our post-training poll and share your insights with our team. So let me go ahead and launch that now. We really do look at this information and use this to help us plan future sessions. And I did put in the chat, there will be 2 more learning sessions for this year. I think I saw earlier in the chat, someone was asking for the calendar invites. So you'll receive those once you register, because we are tracking number of participants through Zoom. Everyone, it is appreciated if everyone individually registers through the Zoom, and then that will automatically send you the invite to your email. But yeah, I think we can stick around for a couple more minutes if folks have additional questions that they'd like to ask Darlene or Esmeralda. And then that way we can also wait for hopefully some results to come in through the survey. And I'll go ahead and stop our recording here for today's session.